Hello, everybody. Okay, here, why don't you come down, sit.
Hi.
Okay, so let's see here.
Oh, my mom just joined. Hi, Mom.
Oh, she wants to see. Yay. So I am just drawing up the local anesthesia for Jasmine right now because we are going to be doing her lips for her wedding. Let's back this up so they can see you. Here's Jasmine. Now, hold on, let me get this good. And then we'll do like that. Oops, sorry, this thing's, I don't know why that is.
What is that?
That's this thing I put on my phone to magnify. Okay. So let me just draw this up. We'll get the tunes a little louder in here because it's can't hear. Okay. And then, so have you've had dental block before?
Yes.
Okay. Let me get this kind of settled. Okay, bring your head back. Is that comfortable?
Yeah.
So we're going to be doing Jasmine's lips. I'm going to turn so you guys can see her as soon as I get her in position. We need to move that closer to you so they see really nicely what is going on here. Okay.
Hi, Joanna.
Hey,
yeah,
Joanna.
I'm excited. Joanna asked if I'm excited. Yes, I am.
So she's never had her lips done. This is Jasmine's first time getting her lips done. We're really excited.
Mm-hmm. My mom's excited for me too.
Yeah? Don't worry, Mom. I won't make her look ridiculous. Okay, so... Okay. And for everyone watching, I am vaccinated. Thank you very much. You are too, right?
Yes, halfway there.
Okay. Don't read it. I'm just kidding.
I did do a mouth rinse before.
Okay, so we're just going to go up in here. 1, 2, 3. Okay? Yeah. Okay. Wow. This side.
Good so far.
Not so
Master
bad.
the pain.
Are you already on?
Who's here?
Are you already on?
Yeah.
Oh.
You got Dr. Justin too. Let me just bring it up a little, as you can see, both. Okay. You want to come in too? We are just doing dental block on Jasmine. Ready for the bottom?
Yes.
Okay.
Ooh, the numbness is starting to kick in.
Yeah.
Would you like me to get the little vibrator?
What? this is live television. Look
Not
at
that one.
Just this for the corner.
Yeah. I'm gonna give it a little more shake. This is what I was talking about.
Yeah.
Alright, special medical vibrator.
Go to the other side.
Okay, hold on. It's all about distraction, right? So, just like when you stub your toe, what do? You rub it to make it feel better, at least hurt less, right?
Yeah.
And that's essentially just kind of negating the pain that's in a certain spot. It's making you kind of get distracted. And so this is the same thing. And the same thing as the shake.
It's coming on.
Mm-hmm. And right here a little bit. I can feel that.
Yeah.
So she's just checking for numbness, right? Checking to see how effective the block is at this time. So it takes a little bit for it to...
I'm trying not to be able to talk here. I can feel like in the middle.
Yeah, it takes a second for that to kind of kick in.
Mm-hmm.
Yeah, it takes a little bit for the numbing to settle in. So even though there is some instantaneous effects of it, it just kind of spreads and slowly blocks out the nerve. And so Sometimes it can take, you know,
Don't feel this at all.
5 minutes, 10
Not
minutes.
right where you first did, but in the middle still.
Right in the middle. So.
And so she's just reassessing where she feels, where she doesn't feel, and decide on the need for more numbing medication in
Still
certain
a little
areas.
In the middle? I mean, I could just inject nil if you want, and then it'll be done.
Bye.
But if you feel like it's kicking in.
Bye. Ashley, saying
That's
bye.
definitely-
Bye, Ashley.
I can't move my mouth.
Still feeling in the middle?
Right where you last poked. A little bit in the middle.
Nick, so do you ever do any injections?
Yeah, I do. It's just painful. So it's something. If I do a big enough bolus, it kind of goes.
So we're just discussing where to put the numbing. Obviously, there's a nerve that comes out here that gives sensation to the upper lip, and there's a nerve that comes out down here and up to the bottom
Superior
lip.
and inferior labral arteries. Or no, labral. Oh, I'm thinking. Forget.
So,
That's cool.
I feel like
yeah,
it's
it's
all-
an inferior oral nerve.
I think I
yeah,
can
I was thinking the arteries or something. What?
I think
But
I can feel
even
it
when you
now.
get those, they
I
don't
like
necessarily
covering.
cover everything, so there's some crossover, and a lot of
Can you
times
feel
the central portion is still a little
Just kinda-
sensitive, so that's what she's checking.
Oh, no, I can.
And she's going to give a little more in these areas to get the central portion. And so she's doing a little shake there and a little more numbing right in the center.
Okay, that will get you. Yeah, it's gonna be on your nose too.
There's a little pinchy up
And
in
then just
there,
to
you
the
know.
bottom here.
Oh, I can't feel that.
You can't.
Mm-mm.
Well, let me just.
Give you a little more right in the center. Good.
Did you feel that?
Mm-mm.
Then you're good to go. Yay! Okay, so I'm just gonna give you while you sit here.
So a lot of times patients feel like their lips are already big after the numbing, right? Do you feel like your lips are a little bigger? They're not. It's just, I think it's that decreased sensation, and you can't lose that like proprioception or the spatial arrangement that the nerves give you based on kind of contact with the surrounding tissue. So you feel like things are bigger because you just can't feel them. But they're not yet.
But you can go ahead and I want to bring your head down a little bit. I don't know if you want to adjust that. You go over your camera guy.
So she's kind of repositioning, right? So exposure and position is very important with any procedure, surgery, non-surgical. You want everybody comfortable. You want everybody in the right position for good angles. And
So in Jasmine, I'm going to be using RHA2, which is a newly FDA-approved filler. It lasts for 15 months. It's hyaluronic acid, pure hyaluronic acid, and it is reversible. So I'm going to be using that in her lips.
And she's icing. She has a little ice pack here that helps just with pain control, right? So it's actually the icing effect. It has its own anesthetic aspect. It's distracting a little bit, but also makes you feel a little more numb. Plus, it causes some vasoconstriction, and that means that the blood vessels get smaller. And that means that there's less blood in the area, so there's less chance for bleeding and bruising and things like that. Even though it's, it's never a lot of bleeding, but we want it to be as minimal as possible, so there's very little
Yeah. Do you
bruising.
want to distract me on this
What's a little, the lighting, can I turn the lighting up? Is that what this is?
Yeah. Why does it look dark? It's
dark.
probably because the light's back
Yeah.
here. If you want to reposition that in a way, like closer, like right here.
Okay.
So this
Sorry,
light-
we're gonna move. The camera's gonna
Or-
get a little
or-
shaky. It's a little better there. What do you think?
Yeah, sure.
Hold on. Let's do this. How's that? You good with the height and everything?
Yeah, everything's good.
Okay.
Ready?
Right.
So,
I'm gonna.
do you
just
feel
gonna-
that?
Mm-mm.
I'm gonna use the vibrator again.
I'm just gonna do like this a little bit. Okay, there, just like that. Perfect. Okay. We are gonna get started
Okay.
now.
So I'm putting a little distractor on there. They had asked what filler. It looks like you already answered that.
Yeah,
so
so that's
RHA,
RHA.
which is hyaluronic acid, or HA, as we kind of say, because hyaluronic acid can be a mouthful when you're saying it over and over. And the hyaluronic acid is really a component of our skin, soft tissue, so it's just adding more of what's already there naturally.
I'm just doing really, really small amounts of filler. Really tiny, tiny.
How you doing, Jasmine? Good? All right. Awesome.
You're doing great. Just gonna do a little bit like this, but I know you want it more following.
You think it makes a
shape.
difference when if I move this around or just keep it in one spot? I'm not sure. Yeah, okay.
Jasmine doesn't want to talk.
No, I know, right? It's like when you go to the dentist and they start talking to you the whole time they're working on your mouth, right? And you're like, and you can't talk, right?
Yeah, my lips are so numb.
Well, you got two things, right? We don't want to be bouncing your lips around because it's like a moving target.
I think I need to
Plus-
lift you up. I'm like bending too much.
Okay. Plus things are numb, so she feels like she can't talk that well.
So we got Jasmine's mom watching,
Oh,
and
mama.
I think your mama watching, Justin.
Oh,
right?
yeah, always.
Mm-hmm.
Joanna's on there. She says better. Maybe you're referring to the position of the
The bag?
yeah. Well, no, the camera stuff. I think it was
No.
earlier because it was just a little dark.
Open a little bit for me.
Yeah.
So you can see that I followed, you want to just turn, that I followed her regular shape of her lip. It's just a little bit more full here. You see that? Like Joanna says. Okay. I'll come to that side now. Let me know if I'm blocking the camera. Okay, you want to hold this? So while I'm focusing on Jasmine, do you want to talk about hyaluronic acid and? You know what? I just have to change this.
I was mentioning it for a minute. Let's get in position.
Okay, boss. Hold on, I gotta change this and touch the thing.
So you've worked on her left upper lip so far, right?
Mm-hmm.
Good. Nice. Asking, does she feel anything at all? Are you feeling anything?
Not at all.
Just the pushing around and kind
What,
of
do you
she's
feel-
aware that
do you
things
feel
are
that?
being touched and pressure, but the sharp sensation, which would be the most important thing to avoid, is gone. But I'm just giving it a little distraction with the
It helps with the mental
the
distraction.
vibrator. I gotta come up with a different word.
What, mental distraction?
No, vibrator.
It's the face massager.
Face massager. So right now she's feeling the right upper lip, and she uses a bunch of different techniques for different areas. And this is a more superficial fill, so to speak. And you're working just kind of in the vertical lines, and this gives a kind of bridging effect, right?
So just a
Fences
little bit.
or things as a
Yeah, I'm
reference.
just trying to just give a little bit of rounding up, but
You're
I'm
blocking
going
the
to be.
camera.
Oh, I am sorry.
Yeah. So maybe I'll move it a bit like this. That's on it. Sorry for the tough camera work here.
Can they see me now?
I mean, you're on it, yeah. If you notice, she changed directions. She's working on almost 90 degrees to the last injection. So it's good to crisscross. Kind of like it's good to crisscross when you're adding things, and it's good to crisscross when you're removing things. So I use the same sort of approach when we're doing precision sculpt and we're taking.
So as I go along, I kind of look at her from both sides to see how she looks. I bounce back and forth quite frequently. I'm just going to add a little more here. I think maybe a little bit more. And I look at her from all different angles, because if I only injected her from one side, there's a possibility things wouldn't look completely normal. So I like to look beautiful.
Yeah, it's looking nice.
It's looking good. here.
So now she's back to the vertical fill, and she's working on the lower lip.
And Jasmine doesn't feel anything because she had a dental block. First thing I did was block her.
I'm going to bring the camera in. Sorry for the sketchy camera work here. That way you can see it a little bit better. Again, now she's working more of in a horizontal fashion in that same portion of the lower lip.
I'm just trying to get rid of some of like the lines she has. Just kind of smooth
make it
out
smooth
the lips. But just put it just a little bit so it's not looking like out of control. It still looks natural. So we worked on the top, and I'm working on the bottom a little bit here. And I'm just putting in little teeny tiny boluses as I go along, just to maintain her same natural look. And within the pink part of the lip, I don't want any filler up here or any on the other side of her vermilion border. So even right here, you know, she has some swelling above it, but that's kind of where the poking sort of started.
So I'm asking, how long does the filler last? How long does it last?
So this particular filler lasts 15 months. It is one of the longer lasting fillers that are out on the market. When's your wedding? Your wedding, I shouldn't ask you as I'm injecting your face, but so Jasmine's getting married in June, right?
Yes, June.
In June, she can't talk, as you see. Notice her lip is curling this way because she has a dental block. So we're just kind of trying to maintain the same sort of shape. So far I've put in a little more than half of the syringe on her. Am I in the way again?
No, just how long does it last? Do you need, how often does one need a refill? I don't know, how often do you see people coming back, especially after their first lip augmentation?
You know, some people don't want, sorry, I keep on saying. Some people don't want a full syringe on their first time. They want a much more natural look. Not like you're not looking natural. Just open for a second for me. I'm just gonna look.
And the question is do you have to keep?
It's really whenever they feel like they need more filler.
Right. So that could be. Sometimes they can come back in a few weeks because they want more volume.
They only wanted a half syringe to start, and now they're like, wait a second, I kind of want a full syringe.
Do you need the vibration in there, or you're good? Okay. So she doesn't even need this, so we're gonna just set it aside. But she doesn't feel anything. So, I mean, it varies. Some people will come back in 6 months. Some people will come back in a year. Some people will wait 2 years. It all depends on what they want volume, what their lips to look like. And if you're asking how long does it last, well, some people feel like, oh, it's gone down after 6 months, and they get a little booster, and then sometimes that will push them out for a year. The longer lasting fillers are better in that sense because they're lasting longer.
Here, switch with me so I can.
Some people say, do you have to have a dental block? And the answer is no.
You don't have to, but trust me, it's way more comfortable. It's a lot more comfortable. Patients are, Jasmine's not even feeling these pokes. If you've ever had a little pimple like along the lip line and how incredibly painful that is, imagine the needle, can be just as painful in some cases. So patients love the dental block.
Right, but if you don't want it, I mean...
You don't have to have it.
You don't have to have it.
We do have topical, although it doesn't work as well, but we do have that.
And ice, you can cool it down, and that gives a little bit more anesthetic effect, but... It's nice to be as comfortable as possible and not kind of flinching and moving around is good for you, but it's also good for Dr. Sarah here because a more stable, relaxed patient, you can really just focus all on the injection and not have to worry about the patient kind of moving around or feeling too much.
Yeah, I feel like I want to stop there with you, Jasmine. I have a little bit, but maybe I could use it as a booster after. What do you think?
Mm.
So let me massage. I mean, I think I like that. I can hold this for, let me see the Vaseline.
So what you doing now, Dr. Sarah?
I am getting Vaseline just to do a little massage and massage her lips. So I like to put this on.
Oh, and then it's once you start getting fillers, you have to keep doing it. I'd say the answer is no.
You don't have to do anything, you know.
All right. Yeah, and does it like start a never-ending process? No.
No, but you like it so much that you want to keep doing it. It's typically what it is. I'm just massaging just to make sure it's all very soft, and it is.
Yeah, so you could do it once and then just let it ride, and then if you decide that you don't want to do it anymore and you let them just kind of go back to where they were, you don't need any more filler. You can wait as long as you want to get the next one.
I think for Jasmine, this is a nice stop point.
Oh, Ashley said she's already loving the results.
Yay.
And then my mom says beautiful.
Let's see.
It looks really good already. And there's some hearts and let's see here. Seriously.
It's not too big. It's not too out of control. And then when it things.
So it says, seriously, it brings out her eyes. And then she says, needs a little more on the bottom.
Here, look at the camera.
Let's see.
So she's got good fill on the bottom and the top. The what people like now is a 1-to-1 fill. They like, the top and the bottom lip being very close in size, versus before where it was like 1 to 1.6. The bottom was actually almost twice as big as the top. People don't want that anymore. They kind of want a 1-to-1 lip, and so that's what Jasmine has. And so she should expect some swelling and a little bit, maybe more swelling tomorrow. It might be a little painful where the needles went in tomorrow once the numbing wears off. Also, she shouldn't really sleep on her face. Are you a side sleeper or face sleeper?
I sleep on my back, actually.
And she can't even talk because she's got the dental. So she wants to sleep on her back with a little bit of incline is nice, because then it will help decrease the swelling. She can ice it if she wants to take anti-inflammatories. She can take anti-inflammatories. What else? You really want to avoid things that's going to increase a lot of blood flow to the face at this point. So a vigorous exercise for the next 24 to 48 hours. You may want to lay off on that. And then alcohol does thin out your blood. So I do tell patients, just be careful if you are, probably lay off alcohol for the next 2 days. And then also prior to a lip augmentation, if you know you're going to get your lips done that week, don't drink that weekend, Don't make your if you notice, every time I poked Jasmine, there was barely any blood that came out. And that was because she, probably hasn't had anything to drink, hasn't taken anti-inflammatories this week. And so she didn't ooze very much. But there are some patients that come in and just with the single poke, they're just oozing all, and I'm constantly dabbing and constantly holding pressure. And then they're just more apt to bruise. The way Jasmine looks right now, she's not going to bruise from this lip augmentation. So that's great. And she doesn't look so swollen and so out of control that people would look at her and say, oh, you just got your lips done. For her, if she looks at herself, she might feel like, wow, what's I look weird, but usually most people, it fits the face. That's a good thing. Would you add anything else? Are you next?
No.
Anything else you would add?
When do you have what's the follow-up?
So the lips, this particular filler, it lasts 15 months. But with something that lasts so long. This one does have a little bit more propensity to like slowly kind of clump on itself as the days go on. So I'm gonna, I tell the patients, look, just for the longevity, if you want one that lasts a long time, you're gonna be massaging this product in your lips. You may be massaging it in for even a month. Like you did my lips about 2 months ago. I don't feel any of them, the bumps, but I did have bumps from this filler, like for a while.
Minor, right? It wasn't.
Well, I mean, you could see them. I had to dissolve one, didn't I? Didn't I dissolve one?
I'm not sure.
I think I dissolved one. Anyway, it doesn't matter. I'm perfect now.
What I'm
That's all that
asking for
matters.
is
You did a perfect job.
I want, because people are saying, okay, you do this, and then do I have to come back? Or when are you going to see me? How are you going to check up on me? How do I communicate if I have any issues? I mean, those are important aspects.
So if patients are have any issues, definitely if it's something alarming, I want you to call us immediately. I want to know immediately. If you see any major bruising, major skin discoloration, extreme pain that's like outside of the normal, no matter what, even if you have a little bit of pain, you're just worried, you need to call the office the next day. We are here. We will answer our phone. We're always on social media. You can DM us a picture. My patients often do that. And we will, be in touch. I'll be in touch with you and let you know what I think, if it's anything to worry or this or that. If there is a bump or lump, depends how quickly it emerges and if it goes away. I like to tell people, a lot of times it goes away by 2 weeks. So just do some massaging and see if it's gone. At 2 weeks, if it's still there, I'm going to want to see you back in the office, and we'll just put a touch of medicine to smooth out that bump. Typically, it's as easy as that. There are some occasional patients that it's a little bit trickier, but most of the time, it's very, very easy to take care of that. So usually at the 2 week mark, I'll want to see you back if there's any issues. Unless, of course, it's an alarming issue. Then I want to hear from you ASAP.
Right.
Yeah.
And do they have to come back in 2 weeks?
You don't have to come back and see me if you're satisfied and you love it. That's great, You don't have to come back and see me in 2 weeks. There's no mandatory appointment.
Can they do virtual? They could do virtual too, right?
Yeah,
if
we
they're
do.
like, I just want you to see, but I can't come all the way in.
Very good point, Dr. Jovino. Yes, we do virtual appointments. Both of us do. So I could always really hop on a FaceTime or hop on a virtual appointment with you and, see how things are going and what you want to do and how we're going to proceed.
There's a lot of compliments on there that they love the
Thank
lips
you.
from everybody. One was talking about bumps and do they go away, but you kind of just addressed that. I mean, there can be, right, was what she was saying, and they're easily treated if you let us know, right? There's reversal agents, and it doesn't mean everything gets reversed, right? It just means that you can target little spots, and it's really effective, and it just helps treat it almost like within 24 hours. You start getting responses to it. So you just have to let us know,
And for some people out there, and I know you're existing, I don't know if you're currently watching right now, but there are some people that just really, they've gone other places, they've had their lips done other places, whether it was beautiful when they first had it done or it was awful, and it's just something that they don't really like, or they have filler migration, which is very common, to have filler above the lip, where it feels like your lip is kind of protruding out, almost like, isn't one of the Simpsons, like Marge Simpson's lip like that or something? I don't know. But either way.
Family Guy, because that's on our TV every day. Tyler.
Yeah. So if you feel like your lip is protruding out, if you feel like you have a lot of filler up in here, that can all be dissolved. Even if you say like, hey, I haven't had lip fillers in 3 years, it has to be gone by now. No, it doesn't. These fillers last years and years and years sometimes up in this area. And it can easily be reversed. Depends on the filler that was used. If it was a filler that was heavily cross-linked, then it might take multiple sessions to reverse it. But typically in one session, a significant amount goes down. So, and then we can just start over fresh and you can get fresh lips. So that's something to consider. Alexa, turn off the music. That's something to consider. It's just loud. Well, she's hearing me from the other room too. Let's see what else. Definitely only use reversible hyaluronic acid. Alexa, turn it off. Definitely use reversible hyaluronic acid in the lips and anywhere in the face, especially, nose, an area like that. You want to use something that can be reversed immediately, just in case.
What about lipstick? When?
You know, I say like maybe 8 hours later.
Okay.
What do you think?
I think you really could use it anytime.
Well,
Honestly,
there are pictures of holes in the skin, and people have seen that on social media that shows the hole after dermal fillers and how you really shouldn't be wearing makeup right away. So, I mean, you know, I put Vaseline, that's your sealant, that's good enough, it's clean, and you know, just you don't need lipstick, because look how red her lips are right now, just from the procedure.
I think it's fine the next morning.
Oh yeah, next morning.
You know,
I said 8 hours.
the skin is really great. It actually seals up pretty quickly. When you take out the needle, it starts like sealing up. There's elastic components
Do you have
to
a time
it.
frame on
and
that?
Quick. It's quick. Count that.
Quick.
So anyway, I mean, I think it's reasonable. Somebody gets it done and like all of a sudden gets a call to get some, you know, they got to go somewhere, they got to be on camera or something like that, and they want to put some lipstick on. I wouldn't necessarily be mad at them if they did it.
Another good thing is that we do have a product called Filler in the Bottle. That is pure hyaluronic acid, 4 different size molecules. You can put it on your lips. It will increase the life of your filler. So it's great to couple with your fillers as well.
Yeah. So right. So what about on the lips? Besides.
I just said that.
Okay.
I just said.
There you go.
See, he doesn't listen. That's
There
proof.
you go.
You guys are all watching. Proof. My husband doesn't listen.
There's your
What's it?
question.
We have a question.
There was a
For
question
filling
about-
under eye dark circles or sunken look, how do you numb that area? It seems like it would be painful. Okay.
Wait, so she's talking about this. God, it's not. Is it spun around? Dang it, it's spun around. But it says filler in the bottle. It's a great product. It's one of my favorite products. I use it every day.
You want to put on the other
And
side of the
that's-
ring light
and
on
that's the-
swips? Well, put this around here.
Are you sure?
Yeah, hold on a second. Do you know how to do that?
It's all right.
I can't figure out how to
Yeah,
do it.
I don't want to mess it
So
up.
forget about it. Okay, so for filler under the eyes, and I will just use this as an example. So, Jasmine has a beautiful eyelash to cheek junction, but when you have like a big here, why don't you come over here?
Yeah, right.
Yeah. So if there's
Wasting away.
wasting away over here. So for people that don't have it, like you can see, he's got these big dark under eye circles. Well.
Just throwing extra big dark.
Okay, so in order to inject it, there's definitely different methods to do that. There is the serial puncture technique where you just go all the way down to the bone after putting topical numbing cream on it. It can be incredibly painful. It can lead to a lot of bruising. So we like to use a cannula, and that's where we inject approximately right here with local anesthesia and a little epi mixture, so it vasoconstricts, so you decrease bruising, and then sometimes an additional opening right here. And with that cannula, pretend this is it, it just goes deep to the bone up into this area and fills this void, and then we just kind of fan like that, and then from this one can go right into this groove deep and fill from over here. So we're going through 2 numb spots with a cannula. A cannula like looks like a needle to most lay people, but it has the hole on the side of it and the tip is smooth, so it pushes the tissue out of the way rather than cuts through the tissue.
Yeah, and they were asking about the numbing for that area.
Yeah, I
right?
just said local anesthesia, local anesthetic and epinephrine mixture.
Yes. You could also do a block. So this dental block here, which we just did for the upper lip, will also provide some
Infra Orbital block,
uh,
which is right about here.
blocking of this lower eyelid. The problem is that closing the eyelid can be a little weird, and it for an hour or two, not a big deal, but can be. The filler has local anesthetic mixed in it. So as you put it in, you get.
It doesn't help you at all until after you're done with the whole procedure. Then it's not. That's true. That is true. It helps you.
It helps a
afterwards.
little bit.
It helps with post-operative issues. Pain.
So so the topical, the ice, the dental blocks, filler has local anesthesia in it. Anything
Oh, I thought you were gonna say something else.
else.
Jasmine and I are like, clinging on to your every word. No, I think that's great. You like the seropuncture technique.
Yes.
And that's where you go straight down to the orbital rim. It does look very nice. The only thing is you see a series of red dots, and it can be pretty severe.
Can be. I don't know. I haven't noticed a lot of problems with the serial red dots, other than just initially, and then it kind of goes down. But yeah,
the dots last like a week.
And
or
it
two.
can be a little more bruising. I like that technique. I do two techniques. One with fat is a cannula technique because it's hard to kind of.
Oh, sorry, my battery's gonna die. But really, the best filler, and he just touched on it for 1 second, is that the best filler for underneath the eyes is your own fat. It lasts forever. It's the most natural. It looks amazing, and that is where you take fat from somewhere else in the body and you move it over to under the eye area and have it injected there. I personally have had that done. I think it was amazing. It was the best thing I ever did.
The downside of it is it's a little unpredictable in the sense of how much is going to be there in the end point. So it's not unusual to do it. Either it hits it perfect, or it's a little less than what you want, and you do a second round, or and possibly third round. And then once you get to kind of that nice fill, it's there forever. It doesn't stop the aging process, but it does set the clock back. And so you still may want little tweaks of filler in between there, but it establishes a new baseline. It's really great for lower eyelid rejuvenation, commonly used with lower blepharoplasties or eyelid lifts, still volumizing with your own fat as the filler.
What other questions are they asking? No danger with nerves. I don't know what you mean exactly by that.
Not really.
Well, we're injecting the nerves here to...
Well, we're numbing the nerves. If you're talking about the numbing component, not really. Yes, everything is a risk, but it's a very low risk. And injecting it nice and slow and gentle, small needles, minimizes risk to the nerves. But it is possible that a nerve could be, it's a sensory nerve really, that would be changed to some
So someone's saying the fat doesn't dissolve?
Yes, so that's the unpredictability that I'm talking about with fat. So the whole idea is that you get you get an area that needs volume. You put in a certain amount of fat, and it's typically a little overfill because we know we're going to lose some. How much you're going to lose, that's the unpredictability component. You could be losing 50%, you could lose 70%, you could lose 40%. You're going to lose some, and it's a decent number, right? So there's an overfill in hopes that when it comes down, it hits right at that spot. But usually it's a little less than what you'd like it to be, and that's why doing a second fill can be done. It ranges. Some patients get one treatment and then ride it out for a long time. Some people come back in 3 to 6 months and get another little booster with it. So yes, there is some survivability. It's not necessarily dissolving like a HA, which is more of a gel. It's a cell that goes in. It's a bunch of them, and some of them don't make it, and they just kind of fall apart and they get gobbled up by the body.
So one issue with injecting hyaluronic acid in the orbital area is, well, it could be anywhere actually, but is what's called the Tyndall effect. And that's this bluish discoloration underneath the eye or underneath the skin when the filler becomes too superficial. So with fat transfer, they never have that Tyndall effect.
Mm-hmm. No.
So that, and typically patients will have to have their filler reversed, or it can be an issue.
If you keep it deep, and there's not a lot of space here, right? If you feel this area, you can tell there's just pretty much skin and bone, right? And there's some fascial layers and stuff. So you have to stay essentially kind of right on the bone to get into that deepest part of that space. But if it's placed in the skin, especially in this area, sometimes you get this light reflection that gives a bluish type hue, and we call that Tyndall effect. And you don't want that.
So if I got a chin and neck lipo, you could do that at the same time. So if I got chin and neck lipo,
you're talking about from lips?
You would do what? The fat transfer to the eyes, or what? Or we're talking about the lip aug, or we're talking about... We don't know what
we're talking about. Questions in there. If you're doing chin and neck liposuction, the fat that's taken from here is really not nice fat to transfer. It's a little chunky and bloody, and we don't like to transfer it, so ideally we get it from somewhere else, like the love handle, and transfer. If you're talking about lip augmentation during a chin and neck liposuction procedure,
absolutely. If you're talking about fillers along the jaw and chin area, when you're doing sculpting of the chin and neck jawline, I say no, because there's too many vectors that are close to each other. So we like to wait about a month or so before chin and jawline fillers are done after liposculpting.
But you can also do fat transfer to the lips as well, for the eyes. What is this for?
She's saying to the eyes.
To the eyes. You can't use the fat here to move to the eyes. Not good fat.
But you could have fillers done at the same time as chin and neck liposculpting, or fat can be taken from somewhere else and transferred to this area.
Right, so you do chin and neck liposculpting while some fat gets sucked out from here and moved to the eyes. That could all be done at the same.
Sculpt it out. That's
what
what
they
that's
say.
on the lipo. Sucked out.
Well, you know what I mean. And then also, some people like fat transfer to the lips as well. The full face, really. Temples, cheeks, everywhere.
Yeah, it's not unusual if we're doing fat transfer around the eyes. We're also doing other areas like the cheek, like the smile lines, sometimes the lips, sometimes the temple. So it's a pan-facial fat transfer. Doesn't have to be that way, but listen, if we're getting the fat, a lot of times it's easy to get enough for every area that needs the attention.
Maybe we should do a live just on fat transfer.
Yeah, or a fat transfer live.
Yeah, that would be interesting. You don't need it though, Jasmine. All right, well, I think we kind of touched on everything. I know my phone's going to die. So
how's it feeling right now, Jasmine?
Yeah.
It's still pretty numb?
She's afraid to talk because...
Are you getting any sensation back yet, or is it still just as numb as it's kind of peaked and stayed there?
That's so good. Look at you, girl.
It's still a little numb. It's coming back, though.
Okay. Yeah.
Mm-hmm. It is, yeah. So the block doesn't last that long. Some people want to know that. It lasts about an hour to 2 hours after the initial block. So it does come back quickly, but remember the filler itself does contain local anesthetic, so you may have trouble eating. So don't plan on coming immediately before lunch and think you're going to go and have lunch. What is it?
Thanking us for the explanation.
Oh, you're welcome.
Yeah.
What is it? Thank you. All the best. Looking forward to my procedure tomorrow.
Awesome.
Yay! So we're super excited. Can't wait to see you. And for all you guys, we're usually live every Wednesday around this time, 5 p.m. Pacific Standard Time. And if you missed the lives, you can check them out on my Instagram.
Do we know who we have next week yet?
No, I don't think so.
Sure? Okay. All right.
We'll post it. All right. Thank you. Thank you, Jasmine. Bye.
Bye.